In this video, we are going to talk about ways to change how you sleep at night to reduce your back pain. The video is divided by sleeping position, so feel free to jump right ahead to the section corresponding to how you sleep. Importantly, there is no one-size-fits-all or perfect sleeping position, even if the internet says otherwise. What is best for you depends on why you hurt. Pain due to a tendon is going to be bothered by different things than pain due to arthritis. This means a position that feels great for you could be horribly painful for someone else. So try these modifications and see which, if any, help you sleep better. It will take trial and error. Let's get to it. If you sleep on your back, there are 4 main modifications. Number 1 is the classic option of bending the knees up by placing a pillow under the legs, which you've probably already tried. Number 2 is rolling a pillow or a thick towel and placing it in the small of the lower back. This supports the natural curve of the low back and often feels better. Number 3, you have probably not tried, which is placing 1 or more pillows under the glutes specifically. This places the lower back into a more arched position and feels better for many people. Number 4 is to place 1 or more pillows underneath the upper back. Doing so helps bring the top half of the lower back into a rounded or flexed position. If you sleep on your side, there are 4 main modifications. Number 1 is taking a towel, rolling it up, then placing it underneath you in the space located between the bottom of the rib cage and top of the pelvic bone. You can also increase or decrease the thickness of the towel based upon what feels comfortable. Number 2 is to try rotating the torso forward or backward slightly. This opens space and takes pressure off of certain parts of the spine, so often feels better. But it does require experimentation to figure out which direction of rotation and how much works best for you. Once you have figured that out, you can block yourself in place with pillows, either placing a stack of pillows behind the upper back to rotate back onto, or a pillow in front of the chest to rotate forward onto. Numbers 3 and 4 are for people with pain on the bony side of the hip. This is an area often mistaken for being part of the back. Number 3 is to place a pillow, a blanket, or other object under the hip. Number 4 is to take a towel, roll it up, loop it together like a donut, and then place it so that the bony edge of your hip goes into the donut hole when you lay down. Either of these options will reduce the amount of compression on that area of the hip and so tends to feel better. Here's another simple modification I meant to include, which can be helpful for many issues. If you sleep on your stomach, there are 3 modifications. Number 1 is placing pillows underneath the feet. This places the knees in a bent position and takes some tension off the low back. Number 2 is placing pillows under the hips or the lower back. You can do 1 pillow or multiple, just depending upon comfort. This will place the back into a more flexed or rounded position, which often helps. Number 3 is less typical. You can put pillows higher up underneath the chest or the middle of the back. Depending how you position things, this can place the lower back into either a rounded or an arched position. It's worth playing around a little to see which, if any, feels best. This brings us to the end of the video. As I mentioned, there is no one-size-fits-all. Just try these modifications out and see which, if any, help you sleep better. Because in the end, getting good quality sleep will do way more for your recovery than trying to force yourself into an uncomfortable but perfect position. I hope that helped, and good luck with your recovery.